Good afternoon and welcome to everyone. Today, thank you to the organizers and GE for the invitation to share on breast cancer awareness this month during the International Women's Week. Right, the topic that I'm going to talk today is actually on the challenges faced by young women who has been diagnosed with breast cancer. So this is just a general disclaimer that the content and the photos shared has been consented, and do seek advice from your own professional healthcare with regards to the information that we shared here. Okay, as we all know, breast cancer is the most common cancer in women worldwide, and the incidence is increasing and the age of diagnosis is getting younger. And the overall lifetime risk of being diagnosed with cancer is about 1 in 15 women in Malaysia, and this is the statistics from 2016. All right, and when we compare it to the developed countries, it is about 1 in 8. With regards to the age of presentation, in the developed countries, 80% of the breast cancer women are postmenopausal. That means they are older. Whereas in Malaysia, 50% of the breast cancer patients are less than 50 years old, means they are younger. Right. Breast cancer can affect anyone. All right. So in the unassuming, fit and healthy, in the very young as well, the youngest being reported is age 6 years old. This is in Malaysia, in Kelantan. And in males also can develop breast cancer, but the incidence is much higher, is much lower, about 1 in 70,000 men. Women who are pregnant, women who are breastfeeding, and even those with no family history of breast cancer can also be diagnosed with cancer. Right? So this is just an example of a man who presented with a breast lump. Now, what are the characteristic profile of a young woman who presents with breast cancer? Generally, young woman, when we refer to young, means we are talking about age less than 40 years old. Right? In Malaysia, we don't have any recent data about what is the statistics of our young patients, but in Singapore, 18% of the breast cancer population are less than 44 years old. Right? And with regards to the characteristics profile, young women who are diagnosed with breast cancer, usually they are high-grade type of tumor, means that the cells will spread and multiply faster. They are the triple negative or the hormone negative type of breast cancer, which is actually one of the most aggressive type among the three. The other second most aggressive is the HER2 positive breast cancer as well, right? So about 30% of the breast cancer patients who are HER2 positive are actually less than 30 years old. They also can present at a more advanced stage during diagnosis. They also have a higher recurrence rate compared to the older patients, and they also can carry a hereditary disease, what we call as the BRCA gene positive breast cancer. Generally, when we talk about treatment options for women who are, whether they are older or younger, it is generally the same, all right? So breast cancer treatment, there are actually 6 types, 6 groups, right? That's surgery, chemotherapy, hormonal therapy, radiation therapy, targeted therapy, and the latest is the immunotherapy, right? And regardless of what the treatment, also largely will depend on the tumor biology and the subtypes of breast cancer. For young women who present with breast cancer, they are usually treated with more aggressive type of therapy, and for that they will present with experience higher side effects. Okay, and one of the side effects that can affect a young woman significantly is actually fertility. Right? And when we talk about fertility, what happens? Chemotherapy, because of the aggressive treatment, right? Most of them will have to go through chemotherapy, and chemotherapy can damage your ovaries, resulting in ovarian failure. Means that there will be absence of menses, ovaries will stop releasing eggs. There also can be chemotherapy-induced menopause. You go into postmenopausal symptoms like hot flushes, night sweats, irritability, depression, anxiety, even suicidal attempts as well. And definitely with this, you have more difficulty in getting pregnant, and the hormone therapy will stop the production of the hormones. So regardless of what, right, life for a young woman after breast cancer treatment, right, we still need to increase the quality of life. So with that, they should be offered fertility preservation options. So what is fertility preservation? That means because we know that their fertility will be affected, we can offer them several options where we can freeze their egg, we can freeze their embryo, we can even freeze the ovarian tissues as well, all right? Or sometimes we can use certain drugs that can shut down the ovary or temporarily stop the ovaries or make the ovaries go to sleep during chemotherapy so that we can protect the damage of the ovaries so that next time they can be able to, have children. So the treatment for fertility preservation is actually not time consuming, right? And it can be all done within 2 to 3 weeks before the chemotherapy treatment actually starts. So if there is opportunity for the woman to actually preserve their fertility, then they should be given the opportunity to do so. All right. Generally, young women who have been diagnosed with breast cancer have a higher chance of hereditary disease. And what this means is that there is 5 to 10% of such breast cancer cases can carry a mutated gene, what we call as the BRCA gene. All right. So what happens is one of the gene becomes abnormal, and when you have the BRCA gene mutation, what does this mean? It means that at least 70%, they have a 70% chance of developing breast cancer in their lifetime, and also up to 50% chance of developing ovarian cancer. So if you talk about the normal population who do not have this, who do not carry this BRCA gene, right, then they have a 15% chance of developing breast cancer in a lifetime. So there is a significant difference, right? And who are the people are at risk? So if the young lady has been diagnosed with breast cancer at the age less than 35 years old, right, or there are 2 to 3 in the family who are within the first degree family who has been diagnosed with breast cancer, any males with breast cancer or prostate cancer, many women with ovarian cancer, if they carry triple negative breast cancer or even bilateral breast cancer, then these are the ones who may possibly have a higher risk of having this hereditary disease or the BRCA gene mutation. So as such, if you think you fall under this group or your family has this strong family history, then please get a go get counseling or genetic counseling so that you can see whether you should do this genetic test or not. Okay, so the other aspect of affecting young women with breast cancer is psychosocial issues. All right. So for a young woman, right, who has been diagnosed, it is generally more distressing than the older woman, right? Because, they just started their career path and, they just started their career opportunities. And then, this can impact their employment opportunities. They also have personal life insecurities as well as emotional stress between partners. And there can be family disharmony. All right, financial instability as well because it's just starting. And of course, naturally, there will be body image issues if they have to undergo treatment like mastectomy. Now, having said all that, breast cancer is still curable in this day and age, okay, because of all the recent advances in technology that's available. So what can we do about it? Okay, for all women, we should be responsible and we should empower ourselves to be more aware. So if you to diagnose early, so if you are diagnosed early, breast cancer is curable, right? Treatment again is based on the tumor subtypes and not just solely on your age, right? So early detection and awareness is very important to achieve this. So what can we do? Number one, I think at the end, the take-home message for everyone is be breast aware. Okay, what do you mean by be breast aware? Now, how many of you actually examine yourself or actually do your own breast examination and examine yourself every month, all right? So when we talk about be breast aware means you need to familiarize your breast with regular breast self-examination from as early as puberty. I would recommend that. Okay, remember the youngest that has been diagnosed with breast cancer is 6 years old in Malaysia, right? So we used to think that breast cancer is the disease of the older age group, right? 20 years ago when I was treating breast cancer, we see most of the breast cancer patients are between 50 to 70 years old. Now my patients within the age of 20 to 40 years old are just as many, right? What is breast self-examination? It's just basically examining your own breasts, all right? And this should be done 1 week to 10 days after the last day of your menses every month. And if you are postmenopausal or if you stop menstruating, then you should do it every month around the same time. Okay, so using your middle finger, three finger pads, right? You just have to massage your breast. Okay, you can do it when you're showering or you're lying down. Okay, and this is how there's lots of information that we can share. Now, this is a very good app, Know Your Lemons. You can actually download on your phone, right? They actually have a very good video to show how you do your breast self-examination, as well as they can also give you a reminder that it's time to do your examination, right? In case you forget, right? The presentation of breast cancer, usually at very early stage, there are no symptoms and the lump is actually painless. Right, I tend to see more patients who come with painful lumps or painful breasts, but but rarely, usually the breast cancer presents as a painless lump. And there could be also unusual breast changes like unusual nipple discharge, skin sores, thickening of the skin or redness of the skin, or new lumps that grow, and the nipple, if it's retracted or any part of the skin is coarse or pimply, and very small bumps. All right. So generally, when we talk about breast examination, a lot of time they mention that, I don't know how to examine my own breast. Everything feels lumpy, or everything feels hard. So everybody's breast is different. It can be very soft, it can be very lumpy, it can be very hard depending on our different age group. So when I talk about breast self-examination, is knowing how your own breast feels like, and then if there's any changes out of the normal, ordinary, then this is the time to seek your consultation. All right. Sadly, we still see a lot of late presentation. 30 to 40% of our patients still present, in very late stages, like they'll come with an ulcerating wound, with maggots, a very hard and painful lump that they cannot tolerate or hide anymore, or even bleeding. All right. So these patients are actually not very old, and they don't stay in the Ulu area as well. Okay, they are all within the city, and yet they present late. And this is largely because the delay in presentation is because of fear, taboo, social stigma, belief in traditional medicine. And we need to change this, because we know breast cancer is curable. Okay, so as a reminder, don't be scared. Not all breast lumps are cancerous. 80% of them are benign. All right. So as we grow older, from teenage to perimenopausal to menopausal, our breast changes. So there's fibroadenoma, there can be cyst, there's fluid, which is common in the perimenopausal age group. And if you're if you're lactating, then there can be abscess or fibrocystic disease. Okay, tumor is only 20%. Now, the other thing is dense breast. I think Dr. Dennis will touch on this later. So just as a reminder, dense breast is very common among Asian, especially young women. All right, 70% of the Asians have dense breast compared to Caucasians, and dense breast makes detection of cancer or lumps a bit difficult. Right, and if you have been diagnosed with a lump that is suspicious, please remember to ask for a core needle biopsy, because it is a very simple, safe procedure that we can do in order to diagnose what sort of lump is it. Is it cancerous or not cancerous? And then only decide what is the next treatment. Right. So in general, the next important thing if you have been diagnosed with breast cancer is what is your molecular subtypes. All right. Because knowing your molecular subtypes can nowadays change the decision and the treatment options. All right. So among the three, we have the hormone positive. 70% of the women usually present with this. They are not so aggressive and slower growing compared to the HER2 positive and the triple negative breast cancer. Okay. So triple negative breast cancer among the three is the most aggressive. And then they are common also in the young women. Right. So why knowing your breast cancer subtypes is important? Because nowadays, breast cancer treatment is not one size fits all. Last time it is, you have a lump, you remove your breast, you go for chemotherapy, and then you take oral treatment. Nowadays, it is personalized. That means after we have diagnosed by a core biopsy, personalized means that we can tailor-make exactly what sort of treatment in order to give you the survival advantage or benefit. Right. So generally, once we know your stage of the disease and the type, then you can go into two different pathways. One, if it's early stage, not so aggressive type of cancer, we can offer you surgery first, right? Then, however, if you are in the later stages and the more aggressive type of tumor, then you will have a better survival benefit if we offer you chemotherapy first, right? So just a little bit on breast surgery choices, okay? Mastectomy is removing the whole breast. So if you present late in stage 2, stage 3, right, 70% of our population still present in the late stage because of lack of awareness. Then they undergo mastectomy, all right? And if you detect early or smaller lumps, we can still conserve your breast, okay? That's 20-30%. And in some cases, if we have to do a mastectomy because of late stage or, for choices, but we can still we can still help you to rebuild your breast, and this is called oncoplastic breast reconstruction, right? Nipple sparing mastectomy, we can offer you as well, nipple sparing mastectomy and immediate reconstructive surgery. And what this means is that we will preserve your skin and your nipple areola, all right? And then we'll take out the breast tissue on the inner side, and then we'll fill it up using your autologous tissue, all right? So we can use the tissues or your muscles from the back, and then we will fill it up to the front. This is how it looks like after post-reconstruction. Or we can actually use the additional extra fat, or what we call is the abdominal tires, and then we'll fill up to your breast. Okay, so this is basically like a lot of ladies are happy because this is like a 2-in-1 surgery. So they get a free abdominoplasty as well as a nicer breast outlook at the end. All right. So if you go for breast conserving surgery or a lumpectomy, then you must understand that you need to go for radiotherapy, right? And this is in order to reduce the incidence of breast cancer local recurrence by 60-70%. So, ladies, breast cancer diagnosis at a very young age is still an emotional shock because, once you've been diagnosed, just imagine you're in 30s, you've been diagnosed and, you have young children, you have a young family, you just start up with a career and your finances is just starting at the very beginning, right? They have body image to take care of, and you want to live an active lifestyle, and then you have fertility as well as sexual health. And then when you've been diagnosed with cancer and suddenly you have to think about treatment, and treatment are just not simple treatment. Sometimes you have to go through rounds of chemotherapy, and this results in side effects and loss of fertility. And then you have the emotional struggle that you have to go through, whether what's going to happen to your young children or what's going to happen later. You want to see you want to see your children grow, and then after that you have to deal with recurrence, right? So again, what we're stressing here that we cannot avoid all these things, but we can prevent it by being aware and detect earlier, right? So how to prevent breast cancer? This is about creating awareness. That means what you know now, you go share with your family, make sure everyone knows how to do their own breast self-examination. Go do your breast self-examination monthly, right? Then go for your yearly screening, and also lead a healthier lifestyle, like eat more fibers or vegetables, exercise regularly, have good sleep, and also reduce stress. So I'll just touch a little bit of screening recommendation. What is the screening recommendation? If if you have not done any screening before, then I think at least you should do. So any woman over 45 years old should have both a screening mammogram as well as a breast ultrasound if your breast is dense. But for our local Malaysians, I will usually recommend both mammogram and ultrasound. And if you're younger because of very dense breasts, then you can just do an ultrasound. And if you have the high risk group or you have strong family history of breast cancer, then you should start screening at an earlier age. So just to conclude, breast cancer in young women, it's aggressive. They are usually diagnosed at later stage. They are difficult to screen due to dense breasts. So come for breast ultrasound. And you have to consider any possible or genetic workup, okay, because there is a higher risk of carrying this BRCA gene mutation. And if you have been diagnosed, then you should look into fertility preservation if necessary, and also we should address the psychosocial issues as well. Right? So all in all, breast cancer is curable if it is detected early. So this is the end of my talk, and thank you very much.
Thank you, Dr. Theo. I believe we have a few Q&A chat box there. They would like you to ask a few questions from you.
Yes, please.
Yeah, maybe we have the first question over here. How often we shall do breast screening?
How often should we do breast screening? All right. So screening mammogram should be screening should be done every year, once a year. All right. So at least an ultrasound every year, right? In the Asian, or if you have very dense breast, if in the mammogram is a very dense breast and there's no calcification or it's not something that's suspicious, then you can do mammogram 2 to 3 years once. All right, or biannually, right? According to our CPG guideline, it is a biannual. That means 2 years once you can do mammogram, but I will personally advise ultrasound every year.
Understand. So another question is, I did a mammogram before. It was very painful. So her question is, besides going for a mammogram, is there any other way to detect these cancerous cells in the breast?
Okay. So basically, cancer cells can present in two ways. All right. One is calcifications. Calcifications are little white dots. I think maybe later Dr. Dennis can show what is the calcifications. All right. So calcifications in mammogram are very, very early stage of cancer. Some calcifications, okay, not all. Some calcifications are very, very early stage of cancer. And this is like, if you detect it on mammogram, it's actually very good because it is so early that by the time it becomes a lump, maybe it's 5 years down the road. This is super early. All right. But again, majority of the cancer can present as a lump itself without calcification, and this can be seen on the ultrasound. So generally, you still need both the mammogram and the ultrasound. Yes, mammogram is uncomfortable, that's true. But I think now the newer types of mammogram, unfortunately, to make it less painful, they increase more radiation. So now the mammograms are a bit less painful because they don't have to press so much to look for the calcifications. Right?
Understand.
Yeah.
Another quick question is, what does it mean by dense breast?
What does it mean by dense breast? if I were to tell that, if I were to explain that dense breast, then Dr. Dennis no need to give the talk. I think he will cover that in the next 20 minutes. What is dense breast? Dense breasts are generally a very firm breast. Okay, they have more breast tissue. Okay, compared to less dense breasts, they are all fatty tissue.
I see. Okay, thank you, Dr. Theo. We will continue the rest of the Q&A later on, maybe. So before we move to the next speaker, let us have a short break of a video first.